Hello, everyone, and welcome to my podcast, Don't Get a Therapist Yet. And today I have a very special guest. Her name is Dr. Natalie Stott, and she's a clinical psychologist. So, a warm welcome to you, Natalie. And would you like to tell the audience a little bit more about yourself, please?
Yeah, certainly. So thank you so much for having me, Wendy. It's a privilege to be invited to be a guest on your podcast. So I'm a clinical psychologist and I have been so for, I don't know how many years, a good few years now. And I've been in psychology as an assistant for, since I was, just straight out of uni, really. Um, but I guess my professional work has mainly been within a staff psychology team working for the NHS. So my clients have been doctors, nurses, physios, and especially when COVID hit, I guess, our service really came into its own. We were very, very busy, as I'm sure you can imagine. So my professional experience has really been working with individuals that are supporting and caring for others. And then I now work in private practice. So half of my work is working with trainee doctors, and I do that supporting doctors through their exams, whether that is trying to pass exams or feeling unsure about how to revise and getting stuck with blocks. So very, very practical. But then I also support them therapeutically, psychological support. And then I've got my private practice, which is where I see individuals. And I guess my main specialisms are around work-related stress, burnout, but also perfectionism, people tolerating uncertainty. And I use an approach called acceptance and commitment therapy, which I'm going to be talking to you about today. I'm also EMDR trained and I use compassion-focused therapy, as I know you've spoken before on your podcast. But I'd say at this present moment in time, ACT is my kind of go-to. So yeah, thank you for having me on to share about that today.
Yes, and I love ACT as well. So thank you so much for coming on and telling us more about ACT. And perhaps you could just tell the audience a little bit more about what is ACT, what are the components of ACT, and maybe give some examples if that's okay, Natalie.
Yeah. Do you want me at this point, Wendy, to introduce talking about managing uncertainty, or do you want me just to explain ACT?
I think just explain ACT because it's somebody who doesn't know what ACT is. So it's just like mine's more
Okay.
basic than yours. Mine's sort of what is ACT? So
Okay.
yeah, good
Okay.
question.
Great.
Yeah, yeah. Start with that and
Okay.
sort of start with wide, and then we'll go into
Narrow it in.
setting. Yeah, okay.
Yeah.
Just gonna clap.
So most people,
Sorry, start again.
Most people will be familiar with CBT, cognitive behavioral therapy, or at least in my experience when I speak to clients, most people have heard of CBT, but less familiar is ACT, acceptance and commitment therapy, is what it stands for. And the way that I describe it to people is that it is about learning a different way of relating to your thoughts and your feelings. And so, ACT in a nutshell is not about trying to identify all the difficult thoughts and feelings we have and change them. Actually, what ACT says is that we can't control our thoughts and our feelings, which, if you think about that, is quite rev- um, a revelatory way about thinking about our thoughts and feelings, because the human response to things that are difficult or challenging is to try and get rid of them. Now, ACT would say that when we're putting all of our energy into trying to get rid of things that are uncomfortable or difficult, actually that's taking our focus away from really what matters. And so ACT is all about walking somebody on a process to identify what is life about for you? Who are you as a person? What are the things that bring you alive? And how can you get back to that place? How can you manage these thoughts that come up that seemingly take you away from the person you want to be? And how can we use an understanding of who you are and who you want to be to motivate you to be that person? And so it's a really beautiful model, and the core of ACT is really that what we want to do is help someone be psychologically flexible. That's the kind of the technical term. We're creating psychological flexibility, and so we can notice our thoughts, we can become aware of what's going on for us internally, maybe how our body is responding. And then we can make decisions on how we want to respond to these thoughts. Because if you think about it, a lot of the time we live life on autopilot. We make decisions, we do things, we react to situations. And sometimes those reactions are not consistent with the person that we want to be and the way that we want to behave. So, ACT is a really practical modality. And there are so many different tools with ACT. It's not just a theory, it's very, very practical, it's skills based. But essentially, it's learning a different way of relating to yourself, to your thoughts, and to your feelings.
Yeah, absolutely, Natty. And that in itself, just that sentence, like you said, that's what psychological flexibility means, isn't it? You know, that those choices and opportunities, that richness, and actually thinking, yes, you can. You don't actually have to buy into this thought. You don't have to sort of like be a whole prisoner to your thought as well, isn't it? You know, that in itself is so freeing. Perhaps I know
Yeah.
we wanted to really focus in on a particular area of ACT. I know there's so many aspects of ACT we could talk about, but we were going to just talk about one particular area today, and that was tolerating uncertainty. So could you tell me a little bit more what you mean by tolerating uncertainty?
Yeah. So I guess with all the clients that I work with, the thing that I think comes up for all of us is this idea of our relationship to uncertainty. And I think in some ways, as human beings, we have a bias, we have this kind of compulsion to seek out things that are permanent, that are safe and secure, and that are certain. And it's when things feel very uncertain, when there's unknown, when there's risk, that that can cause discomfort in people. And life is full of those moments. And so I thought it might be a good way of um, I thought it might be a good way of illustrating some of these ACT principles, because I'm sure all of us can relate to moments that we have been uncertain. So if you think about there are some things in life that where you choose uncertainty, you actively choose to remove yourself from a place of security to the unknown. So if you think about, I don't know, applying for a job and having an interview, that's uncertain, but it's something that you've chosen. Or maybe going on a date, you're not sure, it's, you know, there's lots of anxiety there, but you've made a decision to engage with that uncertainty. But those are not the moments that cause people distress, I don't think. In my experience, it's the moments in life where uncertainty comes upon you that can be really challenging for people. So thinking about waiting for the results of a medical test, or being made redundant, the loss of a relationship, or the death of somebody close to you. These are the things in life that are unpredictable. And yet we know will happen to us at some point. At some point in our life, we will face uncertainty. And so trying to orientate our lives so that we avoid that gets people quite stuck. So a lot of the work that I do with people is actually helping them manage their relationship to uncertainty. So I'd invite anyone listening to this just to pause and to ask yourself, what is my relationship to uncertainty? Are you somebody that really craves control? Do you love taking risk? Are you somebody that thrives in the unknown? Are you somebody that likes your home comforts? There's no right or wrong in this. It's just, first of all, having an awareness of, how do I manage when things are uncertain? And the reality is that, well, life is uncertain, isn't it? We can't predict the things that happen to us. But what we can do is, one, notice what is going on for us when life does hit us in that way. And two, work on how we respond to that. Because in my experience, Wendy, it's when people are going through these kind of critical points of their life, maybe when they're facing uncertainty, that kind of all the strategies that they've got to manage that either, you know, come to the surface, or they realize that they don't actually have ways of managing that certainty. And so when that security blanket of the known and the secure is taken from beneath them, it really can bring up all these feelings around how am I going to manage? How am I going to cope? And it's often at that point that somebody will come through the door into therapy to talk through what they're noticing about how they're managing.
Mm.
Um, and the work isn't to try and create more certainty for themselves. The work is managing what that uncertainty has brought up for them, how they're managing, what are they using to cope. And I think that's where something like acceptance and commitment therapy really comes into play. What we're not doing is trying to focus all our energy into trying to get back to that place of control. What we're doing is trying to understand our response to it and to learn ways of responding that are going to be healthier, that we're going to be happier, we're going to be feeling like we've got more meaning and purpose in life. Um, but it's hard because uncertainty is really vulnerable, no matter who you are. Uncertainty can be really, really hard.
And
Yeah,
I agree
sorry.
with all that, Natalie, absolutely. And what I find, I notice in people who come to see me, often like you say, an incident happens which creates uncertainty is done to them. It's not their choice. So like it's more like I haven't signed up to that. But often it can actually bring back past memories of something else where they said, like, a common thing that I hear is bad things always happen to me, you know that it is, or I know it's not going to work out again. They're sort of making judgments about their relationship
Mm.
with experiences as well. And I'm just wondering whether you've had experience of that, and if so, how can you perhaps give us some examples of how you would work with that?
Yeah, obviously we all come with our own life scripts and our own experience with maybe how we've seen uncertainty modeled in other people. And so a really key part of ACT is really helping someone to make sense of what is going on for them. Um, and I think our understanding our relationship to ourselves is really important. So going back to my question earlier of what comes up for you when you think about your relationship to uncertainty, inevitably that I believe is going to be rooted in what someone maybe has experienced earlier on in life or has experienced in life. If you think about as a child, if somebody um, wasn't nurtured and cared for in the way that we know children need, then that leads someone to believing the world is unpredictable, my caregivers are not trustworthy. So therefore, someone might then move into adulthood with this lens of, I can't trust other people, or people are going to leave me. And so helping people to recognize that you haven't just arrived at this point as an adult with these scripts, these beliefs, they come from somewhere. And that's a really important part of therapy, I guess, is really understanding that often our experiences are formed from our early childhood experiences and then our life experiences. If you have a trauma as an adult, you lose a parent, that can be massively destabilizing for someone and can then influence how they then, navigate future situations. So there's no shame in that. It's really, really important for us to kind of be aware of. And I wondered if I might talk about strategies that I often see in people, because the key part of ACT would say that there are these things that happen to us that we can't control. And I think we'd all agree with that. Where people then maybe disagree is thinking that um, if they do something, if they do certain things, if they employ certain behaviors, then maybe they'd be able to get rid of this feeling. And my experience is it's those behaviors that we do on autopilot that we don't think too much about that get us stuck. And so I'll just go through of the common things that I've seen in people when sitting with uncertainty. Um, and before I get onto that, actually, just something to say is that whilst we don't have a choice about things that happen to us, we do have a choice in how we respond. And ACT at its core is all about those responses. How do we get to a place where I'm aware enough of what's happening to me that I can influence then how I relate to it? Um, and this is something that I guess is done over time, the more you kind of look into the model. Um, really working on our strategies with how can we have more of a choice. I like to explain it, and ACT explains it using something called a choice point. So if this model is interesting to you, I'd really recommend Googling just on YouTube, if you type in Russ Harris choice point, he's got a really lovely explanation of the choice point. And essentially, what it is this: things happen to you. And when things happen, or situations, you find yourself in certain situations, that will bring up thoughts and feelings. Now, if we're living on autopilot, often what we do is we react. And sometimes the reactions that we have are maybe helpful in the short term. So, I don't know, let's say I've been invited to come on a podcast and I have all the thoughts, oh, I'm useless, I'm rubbish, I don't know anything. If I'm not really thinking about this, what I might do is I might decline the invitation, or I might, procrastinate and say, oh, do you know what? Maybe I'll do it in 6 months' time. Now, short term, that's great because I now don't have to deal with these awful feelings of I'm not good enough. I don't know what I'm talking about. But long term, is that the kind of person that I want to be? Well, maybe not, because maybe I'm someone that really wants to be on podcasts and wants to be able to talk to other people. And so, a really key thing when you're thinking through, I guess, your own relationship to uncertainty is not what is right and what is wrong. We really want to get out of that narrative because that's ultimately a judgment. And what do we know about judgments is they kind of keep us stuck. Instead, it's more helpful to ask yourself, is this working for me? And I often ask, in a very compassionate and kind way, obviously, ask people, well, is this working for you? Because sometimes the short-term strategies can be helpful, but it's really getting out of that immediate picture and thinking about those longer term, who is it that I want to be? Coming back to what I spoke about out at the beginning around your values. So if I got £1 for every time someone told me they were an overthinker, I wouldn't need to be in work because I'd be very, very rich. So if you identify as an overthinker, you are not alone. Um, and it's important to recognize that that overthinking is actually, I think, what our minds do to try and establish some control. When we feel uncertain or we've been pushed into the unknown, what our mind does is say, oh gosh, I'm not familiar with this. It panics and it is trying to reach for that control. And so a way that we do that is we go over and over and over things. This is called rumination, where you might replay a conversation. Now, you and I know that just because I'm replaying a conversation in my head, it doesn't actually change the fact that maybe that conversation happened. But what it is doing is, I call it the illusion of control. It's our mind's way of trying to, in some way, fix what we feel has gone wrong. And so it's a really understandable response. But the trouble is that if you're going over and over and over something that was quite distressing, what you're actually doing is you're keeping yourself in that distress. Can be really, really hard. And if you think about, then when you try and go to sleep, so it's the end of the day and you're winding down, if those thoughts are really going around in your head, well, of course you can't sleep because we know when our body's under stress, our heart's racing, we're breathing faster, and you're not in that rest and digest state that you need in order to be able to go to sleep. So rumination and worry, overthinking is something that our minds do. And it's really important to recognize that when that's happening, because if we can recognize when it's happening, we have a choice in, oh, I noticed that my mind's doing this. Is there a different way that I can relate to this? And I'll come on to a couple of skills that we can use. Um, Another strategy that I often see that people employ when they're uncertain is trying to seek out information. So there's often the rhinos and the hedgehogs. I like to use that metaphor. So in the area of overwhelm, you've got those people that just go really, really small, go into a ball, don't want to face life, don't want to address it. The avoiders amongst us. Actually, a really good strategy sometimes, because if you make yourself as small as you can, if you withdraw from social situations, if you ignore conversations you need to have, in the short term, that actually feels quite good because you're getting away from it. And then there are the rhinos that are the ones that when there's a problem, they charge at it. And this isn't about, again, what's right or wrong. It's about what's working for you. So I'm thinking about, I actually had an experience of a medical test that I had to have. And my personality is, in general, I'm a bit of a rhino. I will go at things, I'm quite direct, I will face things head on. But when I had this uncertainty about this medical test, I just complete head jog, went into an absolute ball because I was scared, because fear makes us respond in a way that is maybe different to how we might otherwise like to respond. It's nothing to be ashamed about. It's actually my mind trying to protect me. Um, and so usually what I might do is a rhino option might be, oh, well, I'm going to look up, I'm going to do Dr. Google, I'm going to look up everything, and then I'm going to try and prepare myself for the worst case scenario. Now, if you're recognizing yourself in that camp, the thing that I would say is that that worst case scenario thinking, what that does is you actually then live the worst case scenario twice. You're again trying to create that illusion of control by planning and throwing yourself and seeking all the reassurance and reading everything that you can. But actually, what that does is it can heighten your anxiety. So sometimes that seeking and gathering information doesn't work for someone. And likewise, hiding in a ball, just being alone with my overthinking thoughts might not work for you either. So this process, the process of ACT, is really about understanding yourself because we are all different and we will all have different ways of managing uncertainty. Other things that I notice are decision avoidance, so procrastination. If you're having to make a decision about something or someone's asking you to do something, that can be something, well, if we just avoid it, maybe it will go away. Um, I often use the example of, those brown envelopes that come through the door. We all know what they are. They're the tax bill. And my husband doesn't open them. He goes into hedgehog mode. Whereas I'm like, right, let's get them open, let's deal with them. But for him, that creates a lot of anxiety. And so it's really understandable. Well, if I just don't open them, then I don't have to know what's there. But it's like the beach ball that we hold under the water. It has the illusion of, well, just because I can't see it, maybe it's not there. But these things are present just because we're not attending to them or thinking about them or dealing with them in the moment. It doesn't mean that they're not important. It doesn't mean they're not having an impact on our behavior. It just means that in the short term, maybe I'm not managing it. But inevitably, the pressure builds, and the minute you let go of the beach ball, it goes poof.
Straight
And
up.
sometimes that can happen. That can happen when we're avoiding things. And then another thing that is really common is people say, well, I distract myself. Well, I'll just do this because I'll stay in distraction. And this is where we can really get into unhelpful behaviors. So we might use, thoughts to distract us, or, well, I'm going to focus on this, or I'm going to put all my energy into work, or, those things that can help distract us or fill our time. But that's actually quite frantic. It makes for quite a frantic life because then you're not sitting still. Just thinking about a client that I've worked with recently who can't even go on a walk without music or a podcast because she's so terrified that when she's out in nature, which we know tends to be a place where people can feel calm and soothed and enjoy the sounds of their surroundings, she fills it with stuff because if it's filled with stuff she hasn't got to deal with, the things that feel uncomfortable, the uncertainty about whether she's going to stay in the relationship or not, or whatever it might be. And so we can use distraction in that way, but we can also use distraction in the way of, I don't know, foods, alcohol, porn, drugs. There are loads of ways that we find ourselves engaging with things that are not working for us in the long term, but they're again that short-term strategy. So if you're listening to this and you recognize this in yourself, one, you're not alone, and two, actually, these are things that we can start to be aware of. We can start to notice, oh, I'm noticing that I do tend to do that. I'm tending to avoid it. And that really is a key part of ACT, really, is being present. So in ACT, we talk about present moment awareness. And essentially, what that is noticing what is coming up for you at any particular moment in time, both what thoughts are coming up, maybe what feelings are showing up. And so we're trying to help people get themselves out of that autopilot living and just living in the moment and recognizing, oh, this is what's showing up for me. This is what I'm finding is hard. Oh, and I notice I want to reach for the glass of wine, or I notice that I just won't let myself sit still. Um, so being able to recognize is the first step before getting into tools and strategies and working through it. Really being honest with yourself about what's coming up um, is the first step, really.
Mm. And there's so many ideas and tools there. And I think I love the idea of actually just starting with something so basic, that self-awareness of actually what's showing up for you as well. And that in itself is massive, isn't it? Because we're so good at sort of tying ourselves in knots with our thoughts and everything like that, and just staying with the moment and noticing that and tolerating that as well.
Mm,
And actually saying, yeah, there is something you can do about that. It's really, really important. And the one thing,
mm.
I love lots of things about ACT, but what I love is the use of metaphors in ACT. And I love that hedgehog and rhino stories because people they just stay in your brain. And like I've got an image of a hedgehog and a rhino now. And I think, oh yeah, there's times when I'm the hedgehog and then sometimes I'm the rhino as well. It kind of stays in your brain in such an amazing way, doesn't it? So it's a really good way of describing things. The use of metaphor in ACT, I think, is brilliant.
Yeah,
Mm.
yeah. And I think anything that gets it out of just talking. I mean, some people find the theory really useful and really getting into theoretical discussions. But I find really effective with people is, using imagery, using, maybe writing out on paper how somebody responds. So one of the first things I'll often get people to do is think about that choice point that I spoke about and think, okay, what are those things I do? What are my away moves? And so those away moves will be, what things do you avoid doing? How do you distract yourself? What are the ways that you try and gain control of something? How do you talk to yourself, when things go wrong? Those tend to be our away moves because they are automatic and they tend to be away. I always think of them, they are moving us away from the person or the life that we want to live. And so, even as you're listening to this, maybe give it a pause and you can just watch that video, maybe scribble out what are those things I do that move me away from the person that I want to be. Um, and that obviously brings us to this idea of the towards moves, because what we're talking about, especially in tolerating uncertainty, is really, really vulnerable. And I think often people avoid the process of therapy because it's hard. Therapy is hard. The hard things are hard. And that is why we all too often go for those easy reach, quick, short-term solutions. The tricky thing is they're not leading us towards the life that we want to have. So kind of recognizing that, I always think is so brave of people, because what you're saying is that I am recognizing this in myself. I'm not happy. I don't want this for the next 2, 5, 10 years of my life. And I'm going to do something about it. And whilst we can't change our circumstances, you can't change the result of that test, change the parents that you had, you can't change that job interview outcome. What you can do is engage in your life in a way that brings you that vitality and that meaning. Um, and a way that we do that in ACT is by looking at your values. So I might just say something about thinking about your values, because often when I meet with people, they will really be stuck and they have lost a sense of who they are. Um, and when I say lost who they are, when I ask people, what are your hobbies? What are the things that you enjoy doing? People are talking about things that they did 10, 15 years ago. And, that just shows how easy it is for us to be on autopilot, that we let 5, 10 years go by without really thinking, I can do something about this. And I love ACT because I think it's incredibly empowering that whilst we can't control our thoughts and feelings, what we can do is control how we behave towards them. And we can make choices that move us in the direction of who we want to be. And so there are lots of different techniques for looking at your values. And when I talk about values, what I'm talking about are those things that bring you alive. And I think Wendy, you've got a podcast episode on values that might be helpful for someone to go and listen to if they want to know more about this. But just in a nutshell, values are behaviors. So when I say to you, what is it that you value? Often people will say, oh, I value my friends, or oh, I value family, I value my pet. You can't be more family, you can't be more friend. But what you can do is be more authentic. You can be more intimate, you can be more fair, you can be more adventurous. And so ACT is about going on a bit of a journey of thinking, who is it that I want to be when I am being adventurous and I'm being compassionate? That's me at my best. And then it's identifying, okay, well, what does that look like? Because we might know how it feels. And often in therapy, people say, well, I just want to feel better. Okay, well, if you were feeling better, what might you be doing more of? What might you be engaging in more? And so asking yourself some of those questions is really helpful because it gives you a sense of what it might look like to live differently. So in the face of uncertainty, you might be somebody that goes into your kind of hedgehog and avoids things. And then that in turn makes you feel rubbish. And you think, well, yeah, I might have avoided that initial feeling, but now I feel really lonely. And then what does that make us do when we feel lonely? We're more likely to make our world even smaller. And so by recognizing that cycle and thinking, okay, I feel like withdrawing, but what I know brings me alive is when I'm connected to people. And so in my vulnerability, actually what I need to do is to connect with somebody else. And just to bring this, give you an example, I was recently working with someone who had a miscarriage, and she was someone that was very used to being the strong one. That was her narrative, that I'm the strong one, I look after everybody else. I don't find it very easy, people giving me help. And yet, going through something like a miscarriage, which is incredibly uncertain, incredibly vulnerable, actually what she needed was people around her, but it felt uncomfortable. And so we went back to what her values were. And one of her values was connection. And so it was uncomfortable, it was difficult, but she reached out to her best friend and she shared it with her best friend, who then came round. And she said it was really hard and it didn't feel natural. So this is coming from someone who really values connection, is also saying this didn't feel very comfortable for me. But ACT isn't about what's comfortable. It's about getting us to a place where we're living the life that we want to live. And there are all sorts of exercises around how you can define your values. So there's a really good website that I can link to in the show notes. Some therapists might use different cards and you do it in a session. Or there are certain exercises around asking, if you were at your funeral, what words would you want people to say about you? How would you want them to describe you? So again, a very practical way of eliciting the things that are important to you.
And a very great answer as well, Natalie, a very full answer and so many ideas and strategies in that, in what you're saying as well. And there's a lovely phrase, isn't there, and to sort of get out of your mind and into your life. And that's such a good
Mm,
phrase, isn't it? It's about, and I think sometimes people come to therapy with the expectation that they're going to sit and talk about their problems, basically, and simply talking about their
mm,
problems, they'll feel better. But I think what you're offering is a whole different philosophy on how they view their problems, first of all, their relationship with their problems, but also there's that sort of, what I like about ACT is that outgoing about what is it you're going to do. There's quite a behavioral aspect to ACT, if you agree with me. So it's about,
yes,
making
yeah,
those
yeah.
connections and everything like that and getting out into your life. So we don't spend all our time ruminating and getting inside our heads and over analyzing, like you say. You don't encourage that.
Mm,
You just really are trying to people to live their values, as you say. And that makes the
yeah,
therapy so much more dynamic, doesn't it, as well? It's much more
yeah,
dynamic and engaging and energetic.
yes. And what I would say is that it is a lot easier said than done. So you might be thinking, oh, this is all very well clarifying my values, but I often use the metaphor of it's almost like you're climbing a mountain and you get to the top and you realize like there's an even better mountain over there. And it is so exciting and it looks amazing, but you're conscious that you don't have the tools, you don't have a bridge that goes from here to here. And I guess that is how I see ACT. It's about identifying where you're at now in a non-judgmental, compassionate way, being really present with what's going on for you, understanding your cycle, and then having an idea of where you want to be. Um, because what can happen is we can create these, I call them gap traps, where we say, well, yeah, I can do that, but first I need to feel differently, or
Yes,
I can go there, but I need to focus on getting myself better first. And I hate to break it to you, but you will be waiting a long time because life isn't about moving when we feel differently. Just to throw in another metaphor, sorry, I'm a bit of a sucker for them.
I
I
love
use the
metaphor.
thermostat and the thermometer. So the thermometer takes the temperature of the room and lets you know what's happening, which is useful, but it's not going to change anything. The thermostat is saying, okay, it's 15 degrees in here, it's freezing. I'm going to turn it up to 20. And really, I see ACT as really a becoming that own thermostat, you setting the temperature for your life and noticing what are those rules between me being here and wanting to get there, because we tell ourselves that it's not possible. And so I wonder if I could just do a bit of an exercise
Mm.
um,
Yes,
for
please.
your listeners. So this exercise is called Mind Your Butts. So it's catchy, so hopefully you'll be able to remember it. And it is a basic illustration of the way in which our mind helps us manage what feels out of our control. But what it also does is kind of blocks us from making change. So grab a piece of paper, and what you're going to do is you're going to think of three things that you would like to do or like to do more of. So you might need to, want to pause this if you're listening and are following along. So I will write mine. So one of mine might be, I want to go to the gym. Another one might be, I want to make a suggestion at work. And another one might be, I want to learn an instrument. So you write your desires and then you write the word but, what comes up. And that will be different. So it's kind of a finish the sentence. And this is what I might get someone to do in a session. I want to go to the gym, but I'm knackered. I feel too tired. I want to share an idea at work, but I'm worried I'll make a fool of myself. I want to learn an instrument, but I might get it wrong. So you can see these buts get in the way of us actually doing the thing that we want to do. Um, and so then what I might say to people is, okay, I want you to cross out your but and in place write the word and. I want to go to the gym and I'm too tired. I want to share an idea at work and I'm worried that I'll get it wrong. I want to learn an instrument and I'm worried I'll fail. And what this does is it acknowledges the reality of life, which is I've got this desire and this is scary, this is unknown, this is vulnerable, and my feelings are overwhelming. I want to go to the gym and I'm tired, and when I'm tired, I can't be bothered. But rather than saying that that is a full stop, what ACT is about is opening up possibility. And there are lovely exercises around using your body to do this, around using the breath. But what we're wanting someone to do is recognize those unhelpful thought patterns that are not working for them and thinking, how can we create a bit more flexibility here? And this is where maybe we would then look at your values. What is it about going to the gym that feels important? Because sometimes people have these things that, oh, I've been wanting to do this for ages, and then they don't do it, and then they get annoyed at themselves for not doing it. But maybe it's the wrong focus for them. Maybe actually the thing that they're saying that they want to do is actually a script from somebody else or an expectation of what they should be doing. So I'd say ACT is all about really authentically wrestling with yourself and what brings you alive, being familiar with your own blocks and your stuck points. And then when those come up, learning to relate to them differently. So, one of my favorite things to talk about is that our thoughts are just thoughts. Our thoughts are not facts. Which, when I first heard that, I was like, oh, yeah, well, of course that's true. Our thoughts are just thoughts. But when it's your own thoughts, people have a very different rule. And so being aware of the way that our own thoughts get in the way of us moving forward is really important because we tend to have one rule for everybody else and another rule for ourselves. And then just to think about this in the context of uncertainty, remembering that a lot of changes that we want to make in life are all about leaning in to the uncertainty. And the way I think about it is, well, I know my current environment. I know what life is like at the moment. I know how I operate and I know how I feel. And if what is coming up for me is unhappiness, anxiety, discontent, then I know enough that actually taking that step into the uncertain, making a change, yes, it is vulnerable and it's hard, but I'm doing it in service of something bigger. And often we do need that. We need, what is this in the service of? Because when it gets hard, you need something to remind yourself of, what is that story you're telling yourself? What is your why? As Simon Sinek would say, if you've seen that TED talk, really important to connect with the value behind it. And committed action, which is the, acceptance and commitment. Committed action is making commitments to yourself on how you're going to put all of this learning into place. When I notice that I feel really uncertain or unsure of something, I notice that I want to respond like this. But actually, what's going to make me live a more fulfilling life is if I engage with adventure and authenticity. So I'm going to live life like that. And that is where I think we see real flourishing in people when we get out of the cycles and the stuck patterns, and we live life more authentically to our values. And perhaps the most important thing to emphasize in ACT is that this isn't about getting a certain outcome. You could live life according to your values and life still not go in the way that you would like. So I will give you a personal example. Um, I had to have a conversation with somebody that I really didn't want to have. It was really hard, and it was one of those, you need to share how you feel and how you want to move forward with someone. Really, really difficult to do, and the reason that you do it, you have to have a good reason, because why are you going to put yourself in a vulnerable position if you know it's going to be uncomfortable? As humans, we want to avoid the uncomfortable. And I'm not sure how they're going to react. If I tell somebody I'm hurt or tell them that I need something for them, I risk rejection. And that isn't fun. We spend a lot of our time trying to avoid that. So, in that example, the outcome is not what is important. I mean, it would be great if, when you have to have a tough conversation or you have to make a brave decision, hand in your notice, that someone responds in the most ideal way and says, thank you for doing that. Thank you for sharing that. That was so brave. I hear you. I see you. People don't respond like that. And so when it's uncertain, the temptation can be, oh no, they might respond like this. And so I'm not going to say anything. But then what you're doing is you're not actually living life by your values. You're living in reaction to the fear of what someone else might do. And so by connecting with your values, it actually helps you to realize that the outcome of this conversation is not that you validate me. The outcome is that I have lived according to what matters to me. And so just trying to make it a bit more practical for people, that ACT isn't about trying to get the outcome you want. It's about trying to live in the most authentic way, living by your values and committing to that, regardless of what life throws at you.
Yeah, that's a really good point, Natalie. And just to add to that, I think what I struggle with a lot in therapy is people want to change somebody else. So they want somebody to respond in a certain way,
Yes.
or they say, I've got a problem with my partner or my boss or my friend or whatever it is, or I can't get a boyfriend because all boys, that's been said to me, are unreliable and like that. And of course you can't change another person, but what you can work on is your response to that situation or that thing. And I think that's really ties in very, very well with your with ACT, where it says, live your life authentically, so that you focus on that rather than, like you say, trying to change somebody where the energy will dissipate, because you can't change somebody. The person has to want to change. So that's a really good way of looking
Mm,
at things. Mm. So
mm.
thank you,
And
Natalie, for giving so much information, and it's really, really good stuff. And I can just tell your enthusiasm for ACT is so great.
yeah, there's a lot there and there's loads more to be said, but hopefully that's given people a bit of a flavour. And if nothing else, just to reflect on their own relationship to uncertainty and what it brings up for them. And then, some overview of how you might be able to manage that moving forward.
I think it's a really good and very clear explanation. A lot of people can really relate to that and start to think about their thinking, can't they? And think, okay, well, what is
Yeah,
it? Where do I get myself caught up in my thoughts, really? And then I love the yes but one. That's really good. Yeah, mind your butts. That's so good. I love the title of that.
yeah.
Thank you so much, Natalie. Very,
Thank you for
very,
having me, Wendy.
very rich. So if people want to get to contact you, Natalie, how can they contact you?
So I've got a website, it's drnataliestott.com. I've got lots of information on there, blogs and that kind of thing. And you can reach out to me that way and happy to answer any questions.
Thank you so much. And that will also be in the show notes. So thank you once again, Natalie, for your
No
amazing
worries.
explanation of tolerating uncertainty using ACT. Thank you.